BraceLab, founded by internationally renowned hand therapist and educator Judy Kolditz, has a twofold mission: to continue the education legacy we started with HandLab of being a clinical education resource for hand therapists, and to provide patients and medical professionals in the U.S. with premium quality orthoses that help them live their life to the fullest, allowing them to continue doing what they love without pain or discomfort. This video of suggested methods of modifying the push MetaGrip, our gold standard thumb CMC brace, is an example of our role in educating hand therapists.
As therapists, we know that one orthosis cannot fit every patient perfectly. Here are a few suggestions for modifications that can adapt the MetaGrip to your patient's needs. These suggestions are from clinical experience and not necessarily endorsed by the manufacturer. It is important to be aware that any brace modification nullifies the manufacturer's warranty and your ability to return or exchange the brace. BraceLab offers a MetaGrip modification kit which includes all the tools you need for modifications. Rolling an edge is preferable to cutting it off. On rare occasions when you may need to both cut and roll, always cut first and then roll. There are 3 locations on the MetaGrip where it may be helpful to roll the edge of the brace for greater comfort. Below the index finger to allow full MP joint flexion, at the bottom of the thumb hole to allow full thumb MP joint flexion, at the base of the thumb to accommodate a slightly bony prominence. Do not trim this area back, only roll it. Only a small area of the MetaGrip's high-temperature thermoplastic polyurethane material can be successfully heated and reshaped at one time. And remember, there is a fine line between heating and melting, so heat cautiously. Heat both sides of the material slowly over the heat gun, being sure the straps and metal insert are protected from the heat. To roll it and hold it in this position until the material cools. You can cool it underwater with cold water if desired. Wear protection on your fingertips because the rolled edge will be too hot without protection. Silicone fingertip protectors are available for this purpose as part of BraceLab's MetaGrip Modification Kit. Some patients with a large thumb MP joint may find the MetaGrip thumb hole a bit tight, but the rest of the MetaGrip may fit perfectly. Or the thumb hole may be a bit high, impeding full MP joint flexion. In both cases, the thumb hole needs enlarging. The easiest way to smoothly enlarge the thumb hole is to trim it with a curved number 12 scalpel blade. This trims off a small amount at a time, keeping the edge of the hole both smoothed and curved. If you need only to lower the hole to allow full thumb MP joint flexion, concentrate your trimming at the bottom of the thumb hole. It is best to reserve this blade for any trimming inside a curve or concave area on the MetaGrip. This curved blade will not be very useful on a straight or convex shape. To safely attach or remove the scalpel blade from its handle, use a hemostat to hold the blade. Used blades should be discarded in a sharps container or stored in a sturdy glass or plastic container with a screw top until appropriately discarded. A scalpel handle, 10 number 12 curved scalpel blades, and a hemostat are part of BraceLab's MetaGrip Modification Kit. Trimming should only occur if you cannot successfully roll the edge enough. The edges of the molded MetaGrip are rounded and smooth, but when you cut off an edge with scissors, the cut edge has squared, sharp corners that are uncomfortable. These sharp edges must be rounded and smoothed. Using a rotary tool, such as a Dremel, with a number 84922 silicone carbide grind wheel at the 15,000 RPM speed smooths the sharp edges. Keep the grinding tip moving and slowly smooth off the sharp edges on both sides of the cut. If you are experienced, you may be equally comfortable using the 35,000 RPM setting. For your convenience, a Dremel rotary tool and the number 84922 Dremel bit may be purchased from BraceLab. Although fitting the MetaGrip will place the thumb's CMC joint in the ideal position, some patients will continue to hyperflex or hyperextend the MP joint when using the thumb. The goal is to create slight MP and IP flexion, so the thumb is in an arc when pinching. Molding a small piece of splinting material on the volar aspect of the thumb MP joint and wearing it under the MetaGrip will allow some MP joint flexion but prevent hyperflexion. If the patient hyperextended the MP joint during pinch before wearing the MetaGrip, it may persist in the MetaGrip. Especially in the early days of wear, you may wish to block MP joint hyperextension. The block is molded proximal and distal to the MP joint when it is in slight flexion and is also worn underneath the MetaGrip. As a therapist, you determine whether either of these removable blocks are appropriate. They should be constructed from the thinner orthotic thermoplastic materials to minimize bulk. For additional MetaGrip modification ideas, go to our clinician's classroom at BraceLab.com and search Modifying the Push MetaGrip for a Specific Patient.
Don't forget to visit us on social. And take a look at the distinctly designed orthoses on our website to decide if you would like a sample to evaluate in your clinic. Contact sales at BraceLab.com.